The contraceptive pill is the most common and easiest to administer contraceptive. According to some statistical surveys, more than 100 million women all over the world use the contraceptive pill. In Italy, on the other hand, according to Istat data, it is used by about 16% of the female population. There are different types of birth control pills, and it is frequently used by women to avoid unwanted pregnancy or for medical reasons. The contraceptive pill is a hormonal contraceptive drug that allows to control the ovarian activity of the woman, suppressing ovulation. Ovulation is that phase of the menstrual cycle during which the egg is expelled from the ovaries and released into the fallopian tube. It is here that fertilization can take place. That is when the sperm meets the egg, starting the pregnancy and then the birth of a new life. To find out in detail what happens during pregnancy, week after week, click here above to see the 3 videos I made. There are 2 types of birth control pills. Combination pill contains a synthetic version of both estrogen and progesterone. Minipill or progestogen pill contains only a synthetic version of progesterone. The choice must always be made by your gynecologist and personalized on the basis of your clinical history and state of health. There are 2 types of hormones in the birth control pill: estrogen, progestin. They are 2 hormones similar to those that are normally produced by a woman and regulate all the activity of her genital system, in particular the menstrual cycle. To find out in detail how it works, phase by phase, and which hormones are released, I leave you the video above. To understand how the birth control pill works, you need to briefly understand how ovulation works. The ovulation mechanism is controlled by a complex 3-level hormone system. The hypothalamus produces the gonadotropin-releasing hormone, GnRH. This stimulates the anterior pituitary gland, called adenoepiphysis, to release gonadotropins, luteinizing hormone, LH, and follicle-stimulating hormone, FSH. These 2 hormones will act on the ovary, leading to the maturation of the follicle and subsequent ovulation. What does the combined contraceptive pill do? It inhibits the secretion of the follicle-stimulating hormone, FSH, and the luteinizing hormone, LH, hormones essential for the ovulation process. We have said that the combined birth control pill contains estrogen and progesterone. The estrogenic component, therefore, has the function of inhibiting the secretion of the FSH hormone, thus suppressing the development of the ovarian follicle. The progestin component, on the other hand, inhibits the secretion of the hormone LH in order to prevent the release of the mature egg cell in the fallopian tubes. The estrogen and progestin contained in the pill, simulating natural hormones, exploit the negative feedback and consequently the secretion of FSH and LH by the pituitary is reduced. This prevents the development of the ovarian follicle and ovulation. It has the task of block ovulation, causing the pituitary gland to stop stimulating the ovaries with its hormones. It modifies the consistency of the mucus produced inside the cervical canal. It is the entrance door that separates the vagina from the uterus, making it denser and therefore less suitable for the passage of spermatozoa. It modifies the lining of the uterus, making it unsuitable for nesting the egg, reducing the likelihood that it will accept a fertilized egg. It interferes with the contractions of the uterus, cervix, and fallopian tubes. These are muscular contractions that play a fundamental role during the fertilization process and therefore the implantation of the egg. When taken correctly, the combined birth control pill is 99% effective. If you forget to take it for a day, the percentage drops to 91%.